I'd like to call the Board of Supervisors meeting to order. Better stand for the pledge. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. You may be seated. Okay, we're getting started. We all know why we're here, to listen to you, to present your case, and keep your ruler to yourself. Yeah, that's for one person, got a little joke. All right, at this time, Commissioner of Revenue, Mrs. Martin.
Good evening.
Good evening.
Good evening.
I'm here to speak on three line items. The first one being additional amount of $3,000 in my vehicle valuation. As I stated before, J.D. Power is no longer doing our vehicle assessment valuation. 3 companies picked up that task, but they picked up the task at a very substantial increase. J.D. Power was charging 19 cents per vehicle. The new company is charging 50 cents per vehicle. So the amount of $3,000 is calculated on 10,000 vehicles at 30 cents, the difference between the two. The next line item is advertising, and that's just basically the increase in ad rates. And the last item is furniture and fixtures of $2,000. That line item has always been in my budget, but I have never requested funding in it until now. I am in need of a desk for my real estate office. So that's all I have as far as additional funding for this year.
Okay. Gentlemen, y'all have any questions?
Marlon, you've got one item in the capital improvement budget, and to keep you from having to come back again, it's $85,000 for the camera software replacement. Can you just tell the board a little bit about that one while you're here?
Sure. We currently are using Stonewall technology. They are no longer going to be servicing our software as of December the 31st of this year. They have merged with a company by the name of Vision Government Solutions. So this is an upgrade to upgrade the camera system, which houses our real estate assessment data. And
Okay. Anything? I got a question. I've talked to you before, and I've discussed it with this board briefly about relief for the elderly or certain income levels for taxes. All right, could you talk to me a little bit about that? Where that is?
okay.
And what is our max? And
Okay. Currently, what is shown online for the scale for tax relief for the elderly is incorrect. The ordinance has verbiage in it that allows me to change the income level based on the CPI increase or decrease for each year. So I have been doing that, and currently this year, the maximum income for household is $28,200. The maximum relief that a taxpayer can receive is $400. And the financial worth is still at $100,000. And that's on 1 acre and their home is exempt. We currently have 60 taxpayers that are enrolled in the program, of which 31 of those are receiving the maximum of $400 against or exempt on their taxes.
so 31. All right.
What
Okay.
about the veterans relief?
The veterans' relief are mandated by the state. We have 46 taxpayers that are enrolled in the veterans' relief. The amount that's deferred for real estate is $64,500, and the relief deferred for personal property under the veterans' relief is a little over about $16,800 on the vehicles.
And the same kind of qualifications of like income, or is that just
No.
anybody that's a disabled vet qualifies?
Anybody that's 100%, a veteran that is 100% total and permanent disabled qualifies automatically.
And gets 100% relief from whatever their taxes are?
They're 100% of relief of their taxes on 1 acre in their home, and if they have a garage, it is on the garage as well.
All right, going back to the other ones, if we were to increase that from 400 to 600, how many people would be affected by that positively?
Well, of course, the 31 that is still now enrolled, and I've only had so far this year 12 other new applicants to apply for the relief. Last year, what was deferred was right at 20,000.
Okay, thank you.
Are people like, is it indicated somewhere that that these programs exist when your tax bill goes out, or is it?
It is on the tax bill, it is on the website, and I do put an ad in the Rappahannock Record. And the time frame for tax relief is February 1st through April the 30th. So I run the ad one time in February, one time in March, and one time in April.
Marlon, how does someone qualify for the military relief there? Do they just have to go through a doctor, or what do they need to provide to you to qualify for that?
They bring me their award letter from the Veterans Administration,
Okay.
which has the date that they qualified as to being total and permanent. Of course, it has the income, but I don't look at that. And it tells me they are, and it has a yes or no if they are total and permanent disabled, a yes or no in that line item.
Okay.
That's it?
Thank you. I didn't know, so
Yeah.
thanks.
Okay. Any additional questions, comments?
Are you thinking about raising that number?
Yeah.
This year?
Yes.
Okay.
Mhm.
You have a picture of your new desk that you're buying?
No, I'm waiting for John to see what's at the middle school first.
All right, well,
Not middle school, elementary school, I guess.
I knew what you meant. We don't know what school is what now.
all right, thank you.
Thank you.
You're welcome.
Gentlemen, we want to do like we did last year. If we get a consensus on whether or not we'll agree with this, or we want to change it or whatever, do we have a consensus that we approve this?
I'm in favor of it.
Okay, I am too. You too? Okay.
Okay, you just-
All right, okay, so we got a consensus on that one. All right, before I forget this, I'm coming back to you to ask, what are you thinking about raising this limit from 400 to 600? Or what's your thoughts?
When's the last time it was?
That's what I was going to ask, when was the
Where
last time it was changed?
She left yet?
Yeah, the last time it was adjusted, it looks like '09.
Yeah.
Yep.
Yeah, okay.
Yeah, I'm in favor.
I'm in favor of that, okay, we are,
Okay.
okay. Consensus on that one, from 4 to 6. All right, let me, where am I? Put my glasses on. Mrs. Davenport, Social Service, Department of Social Services. John, can you tell us what pay, okay, good, all right.
Can what?
I think you're getting ready to do it.
Yeah. I want to.
Good afternoon, everyone.
Good afternoon.
I brought my ruler in just in case anybody get out of hand. I'll come over and pop you on the hand.
See, she already warned me about it.
You know, when we
I
were,
think I'm the target.
you all are probably too young for this, but when we were in school, if you misbehaved, you got a little pop on your hand. So that's what this is for.
That
So.
brings back some bad memories.
Are you? But anyway, good afternoon. Glenn, do you have
Yeah,
my?
he's working on it.
Oh, okay, if it'll come up. If not, it won't come up. Okay.
Is that on?
Oh, we can't see it, but anyway.
You might have to come in.
You got yours up?
This monitor I don't have on, I'm just looking at it on the computer.
If it doesn't come on, Glenn, that's okay.
Just, well, I got a backup plan anyway.
Yeah, just give us a second.
Okay. Most of you know what we do, but I think there are two board members that I have not met before at this venue. So I want to provide just a quick overview on Department of Social Services.
Glenn, which buttons turn these on?
Top one.
Top one. It's already on.
It's on.
All right, I'll just go in from my place.
Okay.
I'll just talk through it if
No,
nothing.
he's going to run it from his computer.
Oh,
We-
okay.
We had a lightning strike last July that affected the cameras and the electronics in here. We thought we had it worked out, but apparently there's another bug.
Oh, let me leave that rule here. I better put it up here because I might forget it. And Brenda will be mad at me.
There we go.
Okay. Oh, there we are. Okay. So we're Lancaster County Department of Social Services. And you go. Our organization is state supervised and locally administered. The state develops the policies and regulations, and the state provides training, technical assistance, and monitoring for the local agencies. There are 120 local social services throughout the state of Virginia. For assistance programs, we administer the TANF program, the food stamp, now known as SNAP, medical assistance programs, and energy assistance programs. For our family services, we do adoptions, child protective services, foster care, and for adult services, we do adult protective services, guardianships, and pre-admission screenings. So where does the money come from? There are fewer than 50 federal grants that help fund us. There's significant funding from the Social Security Act, which supports the TANF, foster care and adoption, Medicaid. There's also a Social Services Block Grant and a federal grant for the SNAP program. State funds are provided with matching funds for salary and operations for our department. There's also matching funds for salary and operations that are earmarked for foster care positions, for Medicaid expansion, and for adult protective services. For client services, funds are earmarked for auxiliary grants and for child welfare substance abuse services. Last fiscal year, over 3,500 households received assistance through either SNAP, TANF, or Medicaid assistance. And for our energy program, we assisted over 400 households. And for child care, we've served 43 families and 69 children. Direct services to clients for last fiscal year, we have 2 foster care cases. Adoption assistance, we have 2. We had 75 CPS referrals. And for adult services, we had 58 reports. We had 10 guardianship cases, and long-term admission screenings were 51. For Lancaster County, our poverty rate is 14%. There are over 1,000 persons who are living in poverty in Lancaster County. Now we're ready to talk about the budget. You were given a copy of the budget, and if you have any questions on the budget at this time, I will entertain them. The budget that was selected this year does represent an increase, and the increase reflects the filling of any vacant positions, training, increased costs for COLA and merit increases, for FICA and other benefits, retirement payouts, and also coverage for the expenditures for the 30-day period between the state and local fiscal year. The local fiscal year is June 1st through May 31st, and the state fiscal year is July 1st through June 30th. So we have that 30-year gap that we have to account for. As far as spending for the county clients, over $36 million was spent by all programs for clients, and that is through Medicaid, TANF, SNAP, the Energy Assistance Program, and that was available for spending in this locality. Are there any questions about the budget?
questions, gentlemen? I promised her that y'all were gonna have some questions. All right, we don't have any, thank you.
All right, thank you so much.
All right, what's your pleasure? We have a consensus here?
We have to find it.
Okay, great. All right, okay, consensus. All right. Ms. Cockrell, River Rim,
It's on page 37 of your
37.
budget book.
Thank you. All right.
Thank you very much, Board of Supervisors. It's a pleasure to see you again, always at this time of year. I'm here to talk about Virginia's River Realm. That's our joint marketing project that we do between Lancaster County and Middlesex counties and the incorporated towns in between. This year, I really wanted to share with you not only how healthy this program is. We have over 16,000 followers on Facebook, over 6,000 on Instagram, 180,000 plus page views on the website, and over 83,000 unique visitors that came and took a look at all of the things that we have to offer here in the region. As we move forward, there's a couple of critical slight shifts that we're going to do this year, and we've already started them. I talked to you last year about more of a interest in Instagram, so that we're talking to a slightly younger audience. We're going to continue in that work, but more importantly, we're really going to focus on outdoor enthusiasts because we have so much great outdoor recreation. Those enthusiasts like to come, they like to bring their families, they like to be part of the outdoors, whether it's from recreation or dining or even where they stay. So it's going to be more influence on them, and specifically on families, whether it's multi-generation families or just mom and dad and the kids. Again, and this all leads to our third priority, and that is overnight stays. We don't direct our marketing to say, please come and stay overnight. We try to tell people these are 2, 3, 4-day itineraries that you can do when you're here in the River Realm. And that's helpful because the more people stay longer, the more money they spend, and the better off our tourism-based businesses are. So a lot more emphasis on reasons to stay longer and to linger longer here in the area. This year, I've asked for $5,000 additional dollars, and it's very specific to, I'm hoping that that's what they have in front of them, Don, is that my request for that?
Yeah.
We have not had on the website something that is a travel planning tool. It's kind of up to you. You go to the website, you pick out the things you want, you write them on a piece of paper, you kind of do your own planning. But now in the tourism travel world, having an app on your phone or having an opportunity on your website to go in and pick out the 1, 3, 5 things you want to do while mom is planning, because mom is the decision maker. Mom's planning, she's picking out what she wants to do. But having a travel planning app facilitates that to happen a whole lot faster. And we didn't have that on our own, and frankly, we really didn't think we should spend the money to design it because that's not what our forte is. So we went and found Visit Widget. That is a third-party software firm. They're working with people like Henrico County. They're working with Tappahannock's Main Street. They work with Chincoteague, Martinsville. And what they do is they use your own content that you already have on your website. They put a little front end, they call it a widget. They put a little thing on the front end, you download it onto your phone, and now you have access to what's on the website for things to do, places to stay, activities, and you can plan that out right on your phone. So that is what we are in the process of pursuing, but I'm particularly excited about it for 2 reasons, and that's this opportunity for notifications. So anybody who shops online, occasionally after you shop, you get a ping on your phone that says, hey, Cabela's is still having a sale, or today there's 20% off on this, or something's coming. That's a push notification. So we'll have the ability with Visit Widget, which will be called Visit Virginia's River Realm, or Explore Virginia's River Realm, we can choose. But we can do push notifications, meaning everybody who's got the widget, we can say, hey, next week, there's a great festival. You ought to, or 3 weeks from now, there's a great festival. You ought to be planning your activity. And we can push things right to people's cell phones and right to their app to say, hey, here's something new that's coming. The other thing we can do is proximity notifications. And I am, even more excited about that, because a proximity notification means once you are here and you have the app, once you are here and you're going to an activity, we can actually geofence that activity and serve up another piece of content to that visitor to say, if you really like this festival, in 3 weeks, there's this one coming up. Or if you're a foodie and you enjoyed getting oysters at this particular event, here's 3 more activities that you can do to get oysters. So it's going to be really impactful when we have large groups of folks that are here, but it's also impactful, I'm envisioning, for all these new waterfront opportunities we have here in the county. So when someone shows up in their boat at Windmill and they plop down, we can serve them up and say, hey, by the way, while you're here at Windmill, you can do these things, or there's these 3 other parks you can go to while you're on the water. So it's a new opportunity. We don't have to do anything other than populate our website like we normally do. We can buy this front-end widget and install it. It has a relatively short 60 to 90-day install because, again, you've just got the content already on the back side. It's a matter of the software going out and reaching for it and building it out. So that's my request for an incremental funds from the board this year. Town of Kilmarnock will also be a part of that requirement this year, as well as we've got some paid advertising that we're going to do for the first time this year to help offset those funds. And I'm hopeful, I had a conversation with Virginia Tourism today, I'm hopeful that things like these apps will be able to be part of grant matches. We are now being asked more and more, what is our own skin in the game when we go for grants? And hopefully this is going to be one of the qualifying items, an app. You can certainly, you can certainly update your website and have that be matching funds to use to qualify for new funds. But if we can put this app to it, I think that's going to go a long way to the grants that we go and apply for year in and year out. So that's my request this year. I'm happy to answer your questions. I want to say thank you, as always, for the support from the county. It's greatly appreciated by the whole team.
I guess one of the questions I got, what are our partner counties doing, like Middlesex and, when we started this, we wasn't in by ourselves, so.
Everybody is still in at the same rate. Middlesex is funding it through their Economic Development Authority as opposed to the county. They just made a structural shift as to who's got the money. They're still in at 25. The town of Kilmarnock is in at 25. Irvington and Urbana are both in at 5 apiece. Whitestone Business Association has been in at 2. So, and I will tell you, and I don't have confirmation of this, so please don't take it to the bank for me, but I've been called by Tappahannock, and they are super excited. They're upriver. They're super excited, and depending on whether or not they will receive budgeted funding, they may join us next year in '25. So,
Didn't we get a grant to promote our parks?
yes, your ARPA grant, you do. You have that. That's correct.
Where are we proceeding with that, or what are we doing with that?
We've spent about $15,000 with Virginia Waterways, and
Waterway Guide.
the town of Kilmarnock's part was $10,000, and then the balance of that was spent for the construction work of the replacement of the Greenville Creek.
Yeah, that was 75,000 of that. Yeah, and that, the website piece, which is coming through River Realm, we've got that in development. We should have it ready to launch within 3 to 4 weeks. And the really cool thing about that is we're taking kind of the template that is being used to showcase the Lancaster assets on the water, and we're going to craft that in such a way that we can duplicate it for Middlesex work at some point in the future. So that's the goal, to have that platform kind of showcase all of the things, under the kind of outdoor waterway piece of it. But yeah, I think that I would think is just about spent.
Yeah.
And I think the Waterway Guide is due out in April, I believe.
Susan, that app sounds really, sounds like a good project to me. I was just wondering, and I'm new on here, so I may not fully get why, but how come you had 25 approved for 2023 and you only ended up spending about half of it? Was there any reason for that? It's showing 12.5 as the actual for 2023 on our numbers.
That may be a misprint.
Okay.
I believe I got the money from Don.
I was going to say, I was like, why weren't you making use of that? So
No.
anyway.
I think that's a misprint.
Okay.
Yeah, no, you guys are amazing. Every quarter, the check comes in, and it works just fine.
Okay. Well, good, because
We're not gonna-
that app sounds like it's something that could reach a lot of people.
Yeah, I'm really excited about it because they're out there, they've already done the hard work. You can see Middlesex's, which is called Explore Middlesex, they're going to use it for their Blue Way Guide and their strictly water activity, but you can go on to any of the app stores, and Henrico uses it for their Parks and Rec. I'm just saying that, John, that might be something, down the road, that they're using it for their Parks and Rec programming. It's mostly, it's started in Texas, it's really all about destination marketing, is what the basis of it is. So,
Do you have numbers of what tourism looked like before River Realm and then after it was implemented?
I do, but I didn't bring that with me.
If you
Supervi-
just throw a number at me, a percentage increase.
It's going to be upwards of 10 plus.
Okay.
Yeah, Virginia Tourism does a really good job of looking at total economic impact of tourism, both sales tax, lodging tax, and employment. And we've been seeing some growth in that, particularly through the pandemic. I mean, I guess we all thought everybody was going to stay home, but they didn't. And I just sat in on a conference call earlier in the week with Dr. Cheryl Bailey. She's at Virginia Tech, and she is in future economic planning. And one of the statistics that she used was that while there's some crunch on the home front in terms of home buying, home purchasing with younger people, they are still willing to spend. They are willing to spend well as long as there is value. And so I think that's why you see folks in the 45 and under group willing to go and spend a lot of money going on the Bourbon Trail, or going to a very great place to eat, or having a high-end experience doing something outdoors, as long as there is value. They may not spend that same kind of money every week, but they're willing to spend that, particularly, and travel is a part of their current goals for a younger audience. So I think that's right in our sweet spot of the people we're trying to attract.
This $5,000 additional request for this coming year.
Yes, sir.
Is that going toward the app? Is that why you requested that?
That's exactly right. If you can see, the app itself will have a one-time setup fee, and then it has an annual fee of $11,000. So this is our first year. Let's get ourselves started. I'm hoping that we can use this as grant match for future years, and that way we don't have to come back and continue to ask. But this is a first year get started.
Have you requested this amount of the other participants?
I'm going to, as you can see in that lower box, Kilmarnock is going to get that same request. We're going to go to paid advertisers for $4,000, which will get us set this first year.
Middlesex?
Middlesex has got the app currently. They did that through their ARPA grant. Our goal is to have that run its course, and then we will, because we're using the same back end, we'll have one platform across all of it, and then Middlesex will be back in the fold again.
If this board didn't approve this additional request, how would that affect you?
Well, what it would do is I would have to frankly, I would have to go find some more advertisers, and this is something that we have historically not done because we've not wanted the web platform to be advertiser-centric or heavy. We are going to do paid advertising through email blasts this year. We've just offered it, and we've got our first person on the line who's interested in doing that, so we'll have to go out and try to source it in the market.
Mr. Chairman,
Yes.
I might suggest that on this particular request, we just hold off on making any decision tonight until we get, at the end of the budget
All
session,
right. All right, good.
the work session.
Everybody good with that? Okay, good. All right.
Okay.
Don, we'll hold off on this
Not
one.
denying it or anything like that,
Yeah.
but just hold off,
I'll send Edna to you with the rules. Just saying. I'm just saying, we might have to stick together over here, just if it came
You should
to it.
always be the first speaker, because this is what happens. We start out and then we start to slow down. Don't take it personal.
I don't, it's okay. Is there any other question I can answer for the board?
Okay, well, thank you.
Okay, you're welcome, thank you.
All right. Okay. Emergency service. Chief Smith.
He's online.
He's online?
Yeah, he's at the National Hurricane Conference this
Oh,
week.
okay.
So he's
Oh, no, that doesn't sound
Is
good.
he, is he on there? Can you hear us, Matt?
Can you hear me?
Oh,
Yep.
yeah.
Okay,
Is it
you're
windy down there?
It's hot.
up.
All right. Can you hear me okay?
Yes.
All right. So I've got my usual three different expense lines: public safety, our public rescue services, public safety radio, and our local emergency expense. So just to start for an overview, for calendar year 2023, we had a total of 2,410 calls per service. Average response time was 10 minutes and 25 seconds. Total call time was 53 minutes and 12 seconds. This was also the fourth year in a row that our agency had over 2,000 calls. This year, the increase was 149 calls to 2022. For this past calendar year, we had 1,030 transports. 556 of those calls were identified as advanced life support, and 474 calls were basic life support. We had 18 transports to out-of-area hospitals and also assisted RGH with 9 patient discharges. On the volunteer side, Kilmarnock Rescue finished the year with 154 calls. Upper Lancaster finished the year with 88 calls, bringing the total countywide call volume for 2023 to 2,652. Out of that, our highest station was, as normal, as Kilmarnock. And that is it for our annual call summary. We also had another,
Hey, Matt, let me ask you a question before you leave that. Do you have like a trend on your response time over the last 3 to 5 years?
we've been hanging right at the 10-minute mark so far.
Uh-huh.
The only thing that usually varies is the seconds.
So it's really been kind of flat over that period of time, around 10 minutes.
Yes, and our emergency response plan requirement is set to 15 for us. So we've been staying in that guideline for the past several years.
Okay.
We had another year of higher than normal revenue recovery as well, most likely due to the still remaining high payouts from the insurance companies post-COVID, and also we adjusted the rates before as well. So for fiscal year 2023, the revenue recovery received was $455,424. So as an increase of about 21,000 from the previous year. The year-to-date amount for this cycle is $219,011, so we're pretty much on track again for that. So, and out of that money, the PDC receives 5% for billing services. So for our overall primary budget, the public safety is, the main goal and objective for this year is still staff recruitment and retention. Our current staff is getting just plagued with overtime. Much of the overtime is mandatory overtime shifts, so where they're only allowed 4 no's a year. This is causing the employees to become burned out, reflecting an on-the-job morale and performance. So we want to try to get this straight and also get them taken care of. So last year we had 2 positions added in if needed. So we're going to try to activate those. We also had 1 full-timer retire this year. It was our first retirement. So right now we're working to fill that slot. Part of the proposal for fiscal year 25 is to keep the current open positions as well as add 2 more full-time positions, 1 BLS and 1 ALS. So for fiscal year 2016, we actually had 16 full-time staff, and then we dropped to 14 for fiscal year 17 through FY19. Since then, we declined to 12, while covering 40% more shifts than when we had 14 full-time employees. That's why I'm trying to bring us back up to speed there. I think once we get the full-time staff back to what is actually needed, I think we'll see a lot of the overtime drop off. Some of the overtime is just can't be corrected for call-outs and stuff like that. But I think the general short staffing shifts we'll be able to address primarily with increased full-time staff. And also in recruiting full-time staff, one of the biggest factors that I hear from for potential candidates is comparison of our retirement offerings, with the biggest change being the hazardous duty supplement. So if we have a full-time employee that has this supplement transfer, they lose it, and that really has turned every one of them off so far. So we started that work in 23, and I'd like to try to continue that to bring that part of our offerings. So that'll affect the current staff and include them with the hazardous duty supplement, as well as allow for any future candidates to be able to easily transfer and keep the supplement that they've already earned. Another item for this year was I'd like to try to fill my old position as the EMS operations captain. I've currently just been doing that work, but I need to try to take a load off of myself, so I'd like to try to fill that this year, either with current staff or have that as a offering for one of the new full-time positions. Our medical supplies has been kind of holding flat for the past 2 years now, so that's been doing pretty well. For a salary increase this year, I had a 5% increase to staff, going off of the consumer price index for our area. The additional shifts is we saw another heavy increase between the last year and this year. So for 2023, we had 233 additional shifts at 5,592 hours. Shifts are 12 hours with two providers. So every year we've been heavily trending up on that. So that has greatly just increased our demand. Also part of the budget proposal is increase in our pay scale. Pretty much moves every position up $1 and keeps the currently adopted scale items. That just reflects what kind of keeps us on trend with everyone else in the Northern Neck and Middle Peninsula, and kind of keeps us competitive. So nobody else has really released what they're doing other than asking what we're doing. So I didn't really have anything to go off of. I think we'll start seeing that in the next couple of months as people get their budget proposals out. But at this time, the pay scale presented keeps us pretty competitive. The vehicle line was adjusted just based on, I've seen increased labor rates in a lot of our repairs, and also to accommodate, hopefully, the ambulance, if it arrives this coming fiscal year, currently is set for late September of 2024. So hopefully nothing changes there. The next increase was on our medical supply line. So this is going to be a tricky one, and ultimately I'm going to have to run this as a capital improvement expense. So what happened is the DEA has regulations that are going to be enforced in November of this year. So this makes it so that we cannot utilize the hospital's drug kits. So I estimated it's to be about 5,000 for ongoing costs for replenishment of medications, but since this will be the first year, we won't really know until it gets into a place to really see what we need for next year. But that's just for, I just took our average drugs that are given every week and figured out what our replacement was going to cost, but that does not reflect the initial purchases. So the new DEA regulations are going to require us to have our own pharmacy, have our own what they call controlled substance regulations at each station that we staff. So we'll have to have 3 of them, and I think the fee is $6,000 each just for the application. So for that, which is why I think capital improvement is probably the best route for that, is because we're pretty much looking at over $50,000 for the initial setup. I also had an actual change for 32301. So in the past, we had our medical director as a contracted services, and he resigned on March 1st. So since then, our new medical director is actually a part-time employee now. So I had a change for 32301 or 3199 other professional services. I took off 15,000 there, making the new total at 2,500, and I added 12,000 to cover his payment under the part-time salaries, 32,301, 1,300, bringing that new total to 262,000. That's all I have for that account. Is there any questions?
Matt, on that new regulation, are there any grants available that they're funding for that?
Currently, there is not. Our only hope right now is essentially purchasing co-ops, trying to get the medications down. And one thing we found is nobody's being consecutive either from all the pharmaceutical dispensers.
So
they're really all over the place on cost.
So currently, we source those drugs from the hospital,
Yes,
and that's no longer going to be allowed?
no.
And is this an administrative decision from the DEA, or is this a congressional act?
It's part of an act.
So,
It just
No, but is it,
really hasn't been enforced in Virginia.
did Congress vote on it, or did they just do it administratively at the DEA? Because there's a big difference, because if it's administratively, I think this board should pass a resolution and fight back.
No, I believe the act went in place in 2021.
Can you do some research and try to find some information on that? Because it sounds like an unfunded mandate to me, and sounds like bullshit.
well, and another thing, Jason, if I heard Matt right, we gotta do it, but we gotta pay $6,000 to fill the application out.
Yeah, it's just.
Is that right, Matt?
Per site.
BS.
And that's not taking into consideration all the construction required to meet the pharmacy standards either.
Yeah.
But, so, I think I've said this before, so the Office of EMS is pretty much at a standstill with all of their financial problems going on. So we've been heavily relying on the regional councils, who have been working really hard to get this sorted out. We've been trying to fight it at both the regional and state level,
We need to
and
unleash
right
the
now
fight on
there's
this.
just no workaround.
We need to fight back as like crazy, because this is an unfunded, ridiculous mandate, it sounds to me, and I think it's BS, and this local government should fight back and should cause a stink, if nonetheless, because that's a lot of money, and it's gonna be ongoing, and it's bureaucratic BS.
What is the deadline, Matt?
We're supposed to have our CSR applications, I think, done by July 1st.
What do your counterparts said about this? Do they agree that it's unfunded mandated nonsense? What's the benefit here?
It's, realistically, it's a mess right now for everybody involved, even the large localities
Then
that have the space and funds to make it happen.
give me some information on this, because I'm going to push this up the chain, and I think this board needs to push back as well, because it's just nonsense.
So there is no partnering with a private sector like our hospital to continue to provide?
We may be able to one-for-one swap a medication, but the logistics behind that is very difficult because they can only, we still have to have the permit for them to transfer the medication to us, and then they're not open at night. So we won't be able to do it at night.
Are we having any problems with the current system that we have in place?
We haven't experienced any problem.
So, I mean, we shouldn't break what's not already not messed up. So I say we fight back against that regulation. And everybody, you should inquire your counterparts to throw the bombs, as they say.
But we only have until July 1st.
Well, so they, I mean,
I guess, I don't know what they,
we'll drag our feet like the federal government does.
And our local regional council, PIMS, is really leading it between the other regional councils in the state. The PIMS director, Michael Player, has been kind of leading the task force against it, and I believe he's already has the state representatives on board, as well as the our representatives with Congress. So they have really done the most work on this out of everybody.
Would you like to meet with Matt and see what we need to do, come back and give a recommendation to what we need to do as a board?
I mean, we can, but I just think he needs to like try to get us some information on
Yeah.
this regulation and then how it got imposed and whether it's a congressional vote by Congress and whether it's administrative. And then I don't want to support this. I want to fight back. It's an unfunded mandate and it's unnecessary. No one has convinced me of anything here so far why we need to change and what benefit this would do other than seems to benefit pharmaceutical companies.
Yeah.
And
Really,
bureaucrats.
we're looking at what Matt's talking about right now, it's not the final cost.
No, it's going to go on and on and on and on, and I guarantee it'll go up and up and up and up.
Don, have you spoken to surrounding
We
administrators?
have a quarterly meeting with the Revenue Recovery Board, and this topic has been brought up. I mean, like Matt said, PIMS is working this from a regional level, but maybe Matt can do like Jason has asked and put together a, information packet on all of this, and the board can, consider it at a future meeting.
All right, okay. All right, so, that it, Matt?
So there's just I just wanted to mention it because there's still so many unknown factors. Our biggest thing is I just can't identify a space that meets the Board of Pharmacy requirements to even house the pharmacy. And there's really no workaround on how to even address that.
Local government should not be in the pharmacy business. That's just outrageous.
It's to meet all of the requirements for daily operation will essentially be a full-time staff,
Next thing
7
we'll have
days
to hire
a
a
week,
pharmacist.
But that's
just
what I'm
doing
saying.
that.
That's really what I'm saying.
Yeah, that's
We have to have pharmacists.
I say no.
But
I mean, we already have been mandated with the radio, and that's been a drip, drip, drip of cost and increases and this and that. And something like this will be just yet another incident of mandates imposed with no money to impose those mandates except for us to figure out how to fund it. And
And the worst thing is that the system currently in place is working.
the radio, we
Yeah.
can justify because it's actually doing an improvement to communications. This is not doing anything but excessive cost and bureaucracy.
Okay, let's move on. All right, what else you have, Matt?
for account 32310, the radio system. I just had an increase under the maintenance service contracts. The generators are just getting more expensive. So that is just to reflect increase in costs we've seen there. That is all I have for that one. I decreased 8203, the equipment, ongoing equipment budget, just because I've been replacing a lot of the stuff off of the Harris contract. So the maintenance of that budget is essentially right now any just critical failures that need to be corrected for continued operations. But as far as mobile and portable equipment, all that has been coming from the Harris contract. So that is all I have for that account. For the local emergency account, 32403, 6017, the volunteer programs, was reduced. So some background on that is CERT became a nonprofit and they're going to be seeking funding separately. So that's a joint line with between the amateur radio group and CERT. The amateur radio group is still staying under us. So I just left their part of that budget and reduced this CERT budget, and they should have a separate request. And then line 6019, the public access AED program. A lot of our AEDs, we have over 30 in the community. Most of them are from 2004 and 2006. A lot of their stuff has gone up, so I've asked for an increase of 1,000 there. And then also have 2,000 in Virginia Quality Life funding available. So we utilize that for the first half of this next year's cycle of replacements. And that is all I have for that account.
Okay, that's it. Y'all have any questions, any further questions, comments? All right. Okay, thank you, Chief. You still there?
All right.
Hey, Matt.
Thank you.
Matt, I have
Yeah.
one quick question for you. On Thursday, we're going to be approving the emergency operations plan. And
Yeah.
in that plan, it states that the response time is, I think you said 10 minutes. And I want to say,
That's a different plan.
well, the national average for response times, I think, is just under 9 minutes. Maybe at some point, we could look at what would need to be put in place for us to lower our response time, even by a minute. Bill, you mentioned it, and you always have a reason to mention everything,
Yeah,
so
yeah.
someone must have said something to you.
Yeah, that's.
Why, I mean, 10 is a good time. I mean, we're certainly here in the country, but we can always work on getting that number down. And maybe you could just inform us at some time on what it would take to get that number down.
That's a separate plan.
Okay.
The emergency management side, the emergency operations plan is Thursday.
Right, okay.
The EMS response plan, that's actually been in place since 2013. That's a separate plan.
Okay. All right. Any additional questions? All right. Do we have a consensus on here, on this one, cut request, budget request?
Minus the
Yeah. I don't know if Jason's
federal
gonna
mandate.
throw something
Well,
at us.
there's only a $5,000 increase right now
Yeah.
under that line item. And there's so much unknown at this
Right.
point.
Well, we have to fund, so.
Yeah.
we
Yes,
can,
I would say, yeah.
take care of it.
Otherwise, I'm fine with it. I
But
don't have
we
the
don't
other issue.
stop, we don't stop
We can
fighting
just,
for
we can
what
still
we
fight
want.
for
I
it.
still think we need to fight back
I
against
agree with that.
unfunded mandates whenever we can.
Yeah,
I
and,
agree
and,
with that.
and just to be clear, we've budgeted in the past for 14 full-time positions. Matt's asking for 2 more in the FY '25 budget, 1 advanced life support, 1 basic life support. The problem is, he's only been able to fill 12 of those 14 in the past years, and now we've had one just recently retire, so he's down to 11 full-time right now. And we are going to work on getting that hazardous duty retirement supplement in place, because that's, currently law enforcement has that, and it's available for EMS as well.
Okay, so I'm thinking we have a consensus here. All right, good, we have a consensus. Okay, Virginia Historic Society, Ms. Hart,
This is page 33.
page 33.
Thank you for having me tonight. The Lancaster, Virginia Historical Society, known for many years of our existence to a lot of you as the Mary Ball Washington Museum and Library Incorporated, is dedicated to local history education and preservation through the operation of a public museum, genealogy and history research library, and a variety of outreach programs for all ages and audiences. The museum campus across the street is part of the Lancaster Courthouse Historic District, as is the building we're in now, and these are designated on the Virginia Landmarks Register and National Register of Historic Places. Our museum buildings include the 1830 Lancaster House, which the Historical Society owns, and the 1797 Old Clerk's Office and the 1820s Old Jail, both of which are owned by Lancaster County. Our request is for funds relevant to the county properties and the services that we provide to the county. County government has entrusted us with the care and management of the Old Clerk's Office and Old Jail for the good of the public for more than 65 years and has seen fit to provide funding assistance for the public operation and exhibition of these county assets. Costs for these buildings include electrical utilities, ordinary and preventative maintenance, janitorial service, fire and safety systems, exhibit and tour materials and signage, and management oversight by professional staff and experienced volunteers with training in history, genealogy, historic preservation, and museum and nonprofit administration. Our Historical Society also supports you, the Board of Supervisors, members of your county staff, and the County Clerk of Court's office with research, advice, and fielding public inquiries. We thus work in partnership with you to successfully preserve and share our county's history and make the museum and courthouse district an educational, recreational, and heritage site for local citizens as well as traveling visitors. We have not requested a contribution increase in probably 20 or more years, despite rising operational costs and economic inflation. So recognizing that current funding undervalues our expenses and services to the county, we are asking for an increase of $1,500 in the general contribution and level funding for the electrical utilities based on current expenses, which those are direct billed to the county. So I'm happy to answer any questions.
Any questions, comments?
We still think that's a pretty good deal and one of the smallest requests you probably get. Just looking at the time and the increase in questions that we get and staff time devoted to things, and we're happy about the growing partnership that we have with the county and trying to help field questions about this building and portraits and the buildings across the street. We get a lot of questions about the county landmarks register, so we're working with planning and zoning on trying to help relieve some of those questions, even more of those that we can help answer. So that's some of what we're doing.
How is the plans for your new building coming?
That it is almost finished, so we are going to have a grand opening sometime this year.
And Don, I guess this one's more to you. Do we have any update on when they're going to fix the roof over there?
We've actually had a recent conversation with the roofer, and they're trying to nail down a date, so it should happen very sooner than later.
Yes, we appreciate that when there are larger issues, with capital improvements or things on those buildings, that we can come to you all and ask for that help and advise on how you can protect these and help us tell the story of the founding of the county and telling the story of the colonial and early American settlement of the county through those buildings.
We really appreciate and thank you how you work with this board. Thank you very much, and the county administrator.
Thank you.
All right.
How close do you work with the school system on educating our youngsters about the history of our county?
It's been less than it used to be after during pandemic, of course, but we used to go regionally. We would try to do one school, at least one school a year through a regional partnership of local museums and do sort of a hands-on education day where several museums would go and we would see the whole school population come through with different hands-on activities. We would like to work more with the schools and on especially with changes in the social studies curriculum and SOLs, in finding ways that, we can fit in local information. I know there was some interest recently about Armistead Nickens and somebody in Chesterfield, I believe, or Henrico, talking about how they work his story into curriculum there. And so we said, well, why isn't that happening in our own county? So, we'd be happy to try to work more with the schools.
Okay, well, thank you very much. Okay, gentlemen, I'm in favor of this. I consent to this. Okay, okay. We have
Thank you.
consensus, all right? Thank you. All right.
Okay.
Haven, Ms. Yeakel. Ms. Yeakel?
Is she online, Glenn?
What page is this on?
This is on page 30.
She's online?
I am here.
Okay, Ms. Yeakel, how you doing?
I'm doing great. I'm doing great. Thank you so much for giving me some time tonight. If you're not familiar with what we do, we provide services to individuals who have experienced intimate partner violence and/or sexual violence. And we provide all of our services free of charge, and we've been doing this for over 35 years. Most folks think of us as a shelter, but we have a wide variety of services, and most of the individuals that we serve don't actually use the shelter. They just utilize our other services. You were provided with information about the number of individuals we serve in Lancaster County, and I want to make a correction because the total advocacy services was just for domestic violence services. With the sexual assault services that we provided to Lancaster County individuals, we served 51 adults and 5 children total. And advocacy services include court accompaniment. We have someone who is in the Lancaster County Juvenile and Domestic Relations Court every Tuesday when it meets to assist individuals who are there for domestic violence, either protective orders or victims for actual criminal offenses. And we provide hospital accompaniment, sometimes with sexual assault victims that requires going to Richmond or Fredericksburg because our local hospitals aren't equipped to do physical recovery exams. We do provide shelter, and in last year, we provided shelter for individuals from Lancaster, and I don't have that in front of me. It was 4 adults and 1 child for 262 bed nights. So basically, the families that we serve from Lancaster stayed approximately 2 months in the shelter. We're not asking for an increase this year because you generously gave us an increase last year. We are looking forward, hopefully this year, to partnering with the Lancaster County Law Enforcement. Lancaster County has been approved for the lethality assessment program, which is through the Virginia Attorney General's office, and we are now just waiting for them to come down and provide the necessary training for these protocols to be carried out in Lancaster County. And it's just a wonderful system out of, I believe, Maryland that gives officers the ability to do lethality assessments on site and get in touch with us so that we can be in touch with the victim immediately, and hopefully therefore reduce the chance of serious injury or death. It's been very successful in other areas, so we're looking forward to it. We're just waiting for that training to happen so that we can do that. I don't know if you have any other questions regarding what we do, but I'd be happy to answer any you might have.
Okay. Any questions, gentlemen? Okay. We don't have any questions for you, Ms. Jagle, and thank you for everything that you're doing.
Well, thank you so much.
Okay. Have a good day.
You too.
Okay. All right, gentlemen. Do I have consensus?
I'm good.
Good. All right. We have consensus here. All right. Let's see. Community Service Board, Mrs. Hodges.
It's on page 30 as well. And if you click on the hyperlink on your computer, it'll bring up the individual budget that they're speaking of, so.
We're not doing all that.
I'm gonna make a change for Thursday night and streamline it, make it a little bit better.
Oh, no, now that we get to see the highlighted, we're good now.
Thank you.
In big letters, you idiots. Hey, thank you.
Thank you.
Good evening, Chairman, is it Palin?
Yes.
I'm going to pronounce it, thank you, and members of the board, and of course, Mr. Gill. I want to begin by extending my thanks and appreciation to you for your support of the Community Services Board. And this partnership continues to bring evidence-based practices to behavioral and developmental services in our 10 counties. I'm not sure if we have some new members on the board. Just to kind of do a quick Reader's Digest version about who we are. We provide, as I just said, behavioral health and developmental services to the 10 counties from Gloucester Point to Colonial Beach. This evening, I also want to raise up your county representative on our board of directors, Pastor Jim Jackson, who is sitting back there, and our ex officio member, Alice Coates, who is also a past board of directors member. And I want to let you know that each of them bring a high level of knowledge and perspective to our board, and we greatly appreciate that. We look forward to working with both of them in the future. So this year, 2024, is going to be an event-filled year with the Community Services Board. We are celebrating our 50 years of service to this 10 counties community of Middle Peninsula and Northern Neck. May 24th, we're hosting a celebration with our community partners. So you should have received mark your calendar. And actually, it's going to be here in Lancaster at Whitestone Church of the Nazarene, where Pastor Jim Jackson is the chief pastor. And additionally, we're going to highlight our 50 years with a new logo and our new website. And I think you're also aware that we are in the process of changing our name from Community Services Board to Behavioral Health. I want to, before I go into the budget, I do want to bring up the national hotline, 988 for crisis services. I don't know if you've heard of that. As I said, it's national. And for our area, the calls go into our hub in Suffolk. And they then screen the calls and, as needed, dispatch to mobile crisis here in the Middle Peninsula. We serve a Middle Peninsula, Northern Neck, and Colonial. But there have been some challenges with that, with the 988 number. So I just want you all to know and the community to know that our COPE line, which has been available for 45 years, still is available to community members. and it is 693 COPE. So if you hear of someone that is having a behavioral health crisis and can't get through, please let them know that the COPE line still works and they can get in touch with us. This evening, I'm here to present our budget request for 2025, as you're aware, and we are requesting an increase of 15%, which in dollars equals $7,536. As you may not be aware, the Code of Virginia states that localities are to match up to 10% of the state monies that we receive. Now, we receive more than just state monies, but the localities are just to match those monies. And because we've received an increase in state monies in 2023 and this year, 2024, that in turn increases the local match amount. In December, I did send out some information about the services that for fiscal year 2023 that we provided in Lancaster County. And from 2022 to 2023, there really was almost a negligible difference in the number of individuals we served. We changed it up a little bit. So for those who've been on the board, we had like probably 20 services that we would list. Overwhelming. We've done it by categories now, by behavioral health, by developmental services, by substance use services. So hopefully it's a little bit easier to navigate. Also, 24% of the individuals we served are on a sliding fee scale, which means that they do not have insurance and they receive services, depending on their income, anywhere from $10 to the full service amount. And that was just a 1% greater than last year. So over and above that, 95 people in Lancaster received prevention services. That's usually primarily in the schools. And our peer recovery service, which the hub is really in Warsaw, but they served 120 people. And this is individuals either with a behavioral health or substance use challenge in the past that are now in recovery. And increasingly, they have lived experience. So they bring a unique perspective to working with other individuals, especially when they're in crisis. I know what you're going through. I've been there. I know what that's like. And that brings a whole nother level of understanding than a professional assisting them. I know what you're going through, and that really does broaden our ability to serve people in our 10 counties, but especially Lancaster County. I would like to add that the wage impact on Lancaster County is almost $180,000, $1,180,000, and this reflects the total salaries of individuals who reside in Lancaster who are on the CSB staff. So we're bringing those monies back to the community. Finally, what I gave you, I want to raise up our 2023 annual report on page 44. The VACSB allots each community services board, and there are 40 across the state, one page to highlight the services. So ours is on page 44. And there is a success story which they always like to have us include. So please, at your leisure, if you'd read that. But what I want to raise up is the picture at the top of individuals who reside in our residential homes who have an intellectual disability, that our staff took them on an overnight trip to the Outer Banks. Many of these individuals have never before taken an overnight trip in their entire life. They chose the Outer Banks, and what you see in that picture is the group at the aquarium on Manteo Island. So this is a second trip that staff have taken in 2 years. And this is an unusual service that we've provided, something our director is passionate about. So, questions?
Explain to me again about the grant match.
The match?
Yes.
Yes. The Code of Virginia says that when they give 90% of the state dollars, that the localities in totality match that by 10%. So what we do is our finance director, based on population, we break that up equally among the 10 counties. Not equal amounts. It's based on the number of people in the population, the census. Does that help?
Yes. And if the localities didn't come up with that match, what would happen to the grant?
I don't know what would happen. What we've done in the past is we have tried to find in-kind donations, like, for example, if, when we were in the schools, we were in the schools providing therapeutic day treatment for many, many years. That was an in-kind match because our staff had offices given to them. But that has dwindled over the years because we're not in the schools. So we try to find in-kind match to try to come up with that. But as you'll see, the amount of money we're requesting doesn't even match the number of individuals who receive services on a sliding fee scale.
All right. I'm looking at last year, it was increased 15%, and they're asking another 15%
Yes, sir.
increase this year.
Yes, sir.
What about next year?
Next year, it depends, as I said, it depends on what the state gives us. As the state increases their money to us, and I will say the General Assembly this past year recognized the need for increase to all Community Services Board, and so I don't want to say windfall, but they recognized the need, and there was additional monies that they set aside for Community Services Board. So I think that in part increased it, but it's a moving target. We can't predict. Sometimes we can't predict 6 months down the road as to what the state will provide for us. There's grants available, and, is always something new, something changing. I wish I could give you more of a forecast for future budgets.
So overall, the state funding was increased across all the regions, right?
Yes, it increased over all the regions. And then sometimes we have opportunities to apply for grants, not just us, but all CSBs. And so that could be state monies or it could be federal monies. But if it's state monies and we get that, that will increase it as well.
Yeah, so state monies, that's really the part where we are supposed to give the 10%. And if I'm reading this right, the board of directors voted to raise that to 15%.
Yes.
Okay. And this $7,000 is reflected.
Yes, sir. And I would also like to raise, we provide early intervention services, which is really a federal program. Not all community services boards provide that. There is no state funding to that in this formula the 90-10. But that's a service that we feel passionate about, and that's for individuals, for babies up to age 3 who might be born with a developmental disability or just being a developmental delay. And that's a very expensive service because it means speech therapy, it means physical therapy, and occupational therapy. So if that program, and in the past couple years, we have not made budget on that, we have been in the red at the end of the year, we have to find the funds for that. But that is a service that all 10 counties get, is early intervention, and it's not in this formula.
Any other questions, gentlemen? Okay, thank you.
Thank you, thank you so much.
All right. What's your thoughts, Dennis?
Mr. Bale, I'm certainly a proponent of this. Since COVID, we've seen our society decline mentally, and I just think it's important.
So you give consent?
I do.
All right, Mr. Geezy?
I do.
I have no issue.
You have no issue? All right, consent. All right. Bay Agent, virtual, Mr. Good, and Mr. Paul. Bay Agent and Bay Transit, all right? Mr. Good, Mr. Pollock. Virtual. Are you there?
Yes,
Okay. All right. You
we're
on?
here. Hi, good evening. I'm Tinsley Goad. I'm the CFO at Bay Aging. And we are the Area Agency on Aging and Community Action Agency serving the Middle Peninsula and Northern Neck of Virginia. Thank you for allowing us to attend virtually this evening. I would like to first recognize our board members from Lancaster, our chair, Mr. Jimmy Carter, and our secretary, Ms. Vera Lee, who serve on our executive committee and have served with distinction on the Bay Aging Board for a number of years. For fiscal year 2025 in aging services, I will let Ken Pollock speak about transit specifically. But for aging services, we are requesting a 3% increase in funding over 2024 levels. These programs include Meals on Wheels, home delivered meals, home care hours, information and education, caregiver support, housing, and other services that help citizens of all ages live independently in their communities. The increase will help Bay Aging offset rising personnel costs that we are experiencing related to these services. Our total request for aging services of $16,722, of course, does not stand on its own, but does serve as a match to enable Bay Aging to draw down the much larger state and federal resources for these programs via the Older Americans Act and other grant programs. The impact sheet, which you received in the grant application, sorry, I'm not there to hand that out, but in any event, it shows the effect of the leveraging aspect in Lancaster County and illustrates the value that more than 2,400 county residents received from Bay Aging Services in fiscal 2023. I'll also note on the impact sheet that we are a very dynamic economic partner with the localities, paying nearly $75,000 in taxes and municipal fees to the county and the towns of Kilmarnock and Whitestone in fiscal 2024. We appreciate the partnership with the board, and I'll be happy to take any questions, or I can turn it over to Ken.
Any questions, gentlemen? Okay. No questions at this time.
Good evening, gentlemen.
Good evening.
My name is Ken Pollock. I'm the Transit Director for Bay Transit. I wanted to first thank you for 25 years of supporting Bay Transit in Lancaster County. We began service in December of 1998. The service we offer is rural door-to-door public transportation for all people, for all reasons. It's different than your typical urban public transportation. We don't run fixed routes. We do door-to-door service. And that's because of the rural nature of our service area. It's very difficult for folks to get to bus stops along a fixed route. So we've taken a model that is a door-to-door service. People call in advance. They ask for a ride. We schedule their ride. We tell them what time we're going to pick them up. We try to group them by location so we don't have to run up to Lively every 10 minutes. We try to group people and then get them all together and run them back into town for their destinations. In Lancaster, we have one bus that operates 12 hours a day and a second bus operating 6 hours per day, Monday through Friday. We provided 11,084 rides in FY23. Over 50% of those rides were work-related, people going to and from work. 25% were for health purposes and 18% were for retail. The remaining few were for going to the community college, legal services, social services, and that was about it. That's about all the rest. We also have a program that's federally funded that is not no additional cost to the county called our New Freedom Program. And this provides rides to seniors and people with disabilities to destinations outside of the Bay Transit service area or after hours when Bay Transit does not operate. For instance, people that want to go to church. It is specific for, you have to qualify by being 60 years of age or have a disability. Most of our rides are for people that need specialized medical services or VA hospital services in Richmond, Hampton, Fredericksburg, wherever their services are. But there's a lot of specialty services that aren't available locally. And for people that don't have a strong support system of family and friends and neighbors, it's very helpful for them to get to their medical appointments outside of the area. We provided 441 of those rides to Lancaster residents last year. Looking at the impact of transit on Lancaster residents, first and foremost is economic development. People ride for a reason. Typically, it's to spend money or to make money. For example, we worked with the Lancaster DSS to help secure transportation for a single mother of two that was job hunting. She now has a full-time job and rides 5 days a week. We pick her up each morning, take her kids to daycare, and then take her to work. And then we pick them all up in the afternoon and take them back home. She would not be able to hold a job without Bay Transit's assistance. She does not have her own means of transportation. Other impacts include medical services and retail stores, and that's where people are spending money. But also, more importantly, they are remaining independent in the community. Bay Aging has a mission, and that is to help people remain out of nursing homes for as long as possible and provide the supports that are needed. Transportation is definitely one of those, and we want to be a safety net for people that can't drive anymore. We are the 4th annual Art and Transit Competition, a judged art competition with the RAL Art Center in Kilmarnock, is underway. We have awards reception on May 31st from 5 to 7 at the RAL Center. We'd invite you to come join us. You may have seen a couple of the winning art pieces that have been displayed on our buses around town. There'll be another one in May. Our 4th winning art piece will be blown up and put on the side of one of our buses for a display. We do raise money through this competition, and it supports a scholarship partnership with the community college for Bay Transit frontline staff, and provides also additional funding for the New Freedom Program that I mentioned a few minutes ago. We are also requesting a 3% increase this year, and that's to keep up with our rising labor costs in order to stay competitive in the market. I would like to discuss in the future your consideration for restoring the second bus in the county to 12 hours per day. Not now, not this year, but possibly in the future. We think we could use that to better access people getting to medical services and shopping opportunities in the middle of the day. And with that, I will answer any questions you may have.
Okay, thank you. Any questions?
I just have one. Ken, how does you advertise for your services? Because I heard your advertisements in the Middle Peninsula, but I haven't heard them locally. So how do you advertise about the transportation services?
We use radio, newspaper, press releases, Facebook, website. I believe in Kilmarnock we're using I can't remember the call, WYND maybe?
WRER, WKWI?
No, we have worked with them in the past. We don't currently have a spot with them. I think it's is it Windy?
Windy 103, yes.
Yeah, that's right.
Yes, we have a contract with Mr. Cunningham to advertise there. We advertise WRAR and there's a radio station in Gloucester that we also do regular advertising with. We try to spread our our advertising dollars around. We try to use different media because of, younger folks are not reading the paper. They're not necessarily listening to the local radio station. So we try to have a presence on social media. We have brochures that we distribute. So we could probably do a better job, but we are trying to get out there as much as we can.
All right. Okay. Any additional questions? Yes.
Ken, you mentioned restoring a second bus. Does that mean that we were using that bus for 12 hours at one time and we cut it back?
Yes. There was a cut quite some time ago. I want to say maybe 8 or 10 years ago. It was a budget situation, and the board elected to reduce funding to half a bus, which we call it, it runs 3 hours in the morning and 3 hours in the evening to help us with people going to and from work, because that's our peak times. But what it doesn't do, it leaves us with one bus in the middle of the day to get people to doctor's appointments and to shopping. And we just can't cover Whitestone to Lively with one vehicle. There's people that have to be turned away. So just asking for that consideration down the road that and I'll be glad to come and talk to you about that when it's appropriate. But we'd like to possibly get that second bus back running 12 hours a day.
Yeah, I'd like to have that conversation sooner than later. Let's get through this budget session, but it sounds like it's important to the county.
Sure.
Okay. Any other questions? All right. Thank you.
Thanks so much.
Thank you very much. We appreciate it. Thank you.
Do we have consensus? All right. Bill? All right. We got consensus. All right. Virginia Department of Health.
Good evening, members of the board. My name is Brennan Rivenbark. I'm the Chief Operating Officer for the Health District. As always, we appreciate the ongoing support. The Health District is seeking a 7% increase over fiscal year 24's request, which comes to the amount of about $22,000, and that's to help the district meet state mandated pay increases to the point of some of the powers that be making decisions for localities. But also we're seeking to recruit for a licensed environmental health specialist specifically for the county. Currently, our only licensed professional in Lancaster is also our environmental health manager. And due to the complexity of the program, we feel it's probably time to help us get a lower level EHS specifically for the county.
Okay. Any questions? No? Boy, you getting off. Okay, thank you.
These usually aren't that easy. Thank you.
All right. What's your consensus? I mean, what's your pleasure?
Nothing to do, Bird.
Unfunded
All
mandates.
right. Yep. Legal aid works, Mr. Briggs?
Good evening. My name is James Briggs. I am the managing attorney of the Tappahannock Branch Office of Legal Aid Works, which has served your Lancaster County constituents since 1979. Thank you for this opportunity to speak with you tonight, and thank you for your previous support. We are asking for level funding of $5,600 in fiscal year 19 through 23. You decided to stop your support for our organization. We understand all too well the tough choices you need to make to balance a county budget. Last fiscal year of 24, we were picked up again, and we thank you for that. Our two-attorney office in Tappahannock covers 7 counties, including Lancaster County. We represent low-income people who need an attorney in civil legal matters such as domestic violence protective orders, unemployment benefits, landlord-tenant, and foreclosure matters. We are the only agency providing this service. In your county, there are 1,561 eligible low-income persons who will qualify for our services. As an outside agency, we behave like an inside agency by helping county governments in 3 ways. The first is taking the strain off of your social services safety net by lifting clients out of poverty with enforceable court orders of child and spousal support, as well as unemployment benefits that the clients would not otherwise have won without our legal intervention. We help the county court system to run efficiently by helping those who cannot afford an attorney. Pro se litigants slow down the court system considerably. Third, assisting local law enforcement agencies by securing enforceable civil protective orders for domestic violence survivors. We leveraged your $5,600 in financial support to provide legal services that benefit your citizens. In the last fiscal year, 35 of your residents were assisted by our 2 attorneys, including several critical domestic violence cases. When you total the amount of real, measurable financial help we give the residents of your county compared to the amount you give us, that is an excellent return on your investment. In the last fiscal year, the 3 offices of our agency obtained over $315,000 for our clients throughout the 17 counties that we serve. When you decide to fund us, you are supporting not just our agency, but your police force, your court systems, and your social services agencies. Your low-income constituents rely on us. And the Lancaster County support we have received in the past made this community safer and more stable for everyone, not just our low-income clients. Fiscally, we run a tight and responsible ship. In deciding which nonprofit to support, I suggest any county should have a vested interest in collaborating with any nonprofit that can show that it is well-run and serves the county's constituents. If counties only give to the ones that are in desperate financial straits, instead of those that are prudent and save against hard times, that might make sense, but I would argue that the nonprofits that do the most good and are best run and are the most financially stable are the wisest investments. We have been advised by many grantors that they look to support nonprofits who follow fiscal best practices. As in your personal and business life, our nonprofit sets aside an extremely modest reserve to make sure that we could exist for 3 months in case of the catastrophic loss of funding. I would be happy to email you a white paper on the subject published by the Urban Institute, which argues that it is a fiscal malfeasance for a nonprofit to run with no policy of setting aside cash reserves. We followed that advice and we were able to weather difficulties and funding peaks and valleys as a result. To suggest that we are well off and don't need support is simply inaccurate. Please consider the support for our agency so that you can truly support justice for all. Again, thank you all for allowing me to be here tonight and to speak with you about our agency. And if you have any questions, I will do my best to answer those questions. Thank you.
Any questions, gentlemen? Statements?
Did you say how many residents you served in Lancaster? Was it 35?
It was 35, yes, sir, in the last fiscal year.
Okay.
Any additional questions? Thank you.
Thank you.
All right. All right, I'll give consensus for this request. Consensus. All right, consensus. All right. Youth Club, Chris Braley. Braley? Yeah. Brawley. All right, thank you.
Mr. Palin, Board, thank you for having us tonight. I'm Chris Brawley, President of the Youth Club of Lancaster County. Tonight with me, I have Dwight Forrester, our Vice President of Facilities, and Brian Manitz, our Treasurer. We thank you for the opportunity to speak with you tonight. We have requested level funding for this year to assist with our park maintenance fund. Just a bit of an update about what's going on at Dreamfields. Baseball and softball season is here, and we are almost in full swing. The high school and middle school have started playing games at Dreamfields last night. Both middle school softball and baseball, junior varsity and varsity softball and baseball hosted games at Dreamfields with quite a large crowd in attendance for all 6 of those games. Little League season is just around the corner. Our opening night is Friday, April the 12th, with games going on beginning at 7 p.m., and everyone is welcome. Besides Little League and high school sports, we host special events and other baseball tournaments, including the 4th of July fireworks that we've hosted the last couple of years in partnership with the Kilmarnock Fire Department, as well as 11 and 12-year-old baseball tournaments. We do have a tournament coming up this spring, April 19th through 21st. We will be bringing in 18 teams from Richmond, Northern Virginia, and the Hampton Roads area for the weekend. And please, everyone, come out, support. There are several kids from Lancaster County playing in this tournament on the various teams. So everyone come out, support them. Please come to opening day. Currently, we have about 160 children playing Little League this spring. That consists of 15 different teams across 8 different divisions. So we are, the park is crowded these days. But not only with Little League and our park maintenance, but we have invested significant capital expenditures in upgrading our park over the winter, and I will let Dwight speak to those projects.
Thank you. So over the winter, we've upgraded our bullpen facilities with AstroTurf. It's going to help us out in the future with maintenance and wear and tear, and just a much nicer facility, more uniform facility for the kids to play, especially with the amount of use that it's getting. When you're thinking, we have JV, high school, Little League, now the middle school ball, and those programs are in full swing. So we've upgraded both the high school bullpen, replaced the fencing on the high school baseball field, significant improvement there, and also their bullpen area. We replaced all the roofs on the Little League dugouts, some significant cost there. And we also installed a new double stall batting cage, one that is extra long for high school play, so that they can double as pitching and batting cages. Really great project. The park has really come together this year, and we have a few other planned facility updates. And any questions for us on facilities? Everything is looking really great. Last night, the park just shined. So many compliments, to our facility from the other counties and stuff that are there. They all wish they could be like us in Lancaster County. So, and it's not just, it's a whole community, and you all know that. I mean, so many people are giving their time and, volunteering time, with labor, equipment, materials. So we couldn't do it without the community support and your support as well. I'll talk about are you going to talk about the back? Our capital improvement projects, we don't have anything major going on right now. We are trying to update our restroom facilities to be ADA compliant. So that is an issue that we do have at the park. So that's what we're trying to do right now. We're looking at some grant opportunities to help us out with that. So that we would build a bathhouse in between the high school boys field and the girls field, kind of back where the new batting cage is, past the concession stand, if you can picture that. And then in doing that, we'd also like to upgrade some of our sidewalk areas to make it more accessible for some of our visitors who have special needs, you know, in wheelchairs or need to be on flat surfaces, you know, to go and watch their grandkids or whoever play. So that's in the planning stages right now. More to come on that. And that's, anything else, Chris? Any questions for us?
How far down the road is that bathhouse? And Don probably know why I'm asking this. Because we got a lot of, you know, we got a big project going on over
We've
there.
noticed.
Yeah.
We've noticed.
We have, we've been working we've developed plans for it. We have a preliminary budget for it, and we are working with River County's foundation in their grant process. That grant is due the beginning of April, and they award their grants in, I think, June. And so if we're fortunate enough to be awarded the grant, I would not expect any type of construction to happen until late fall.
Yeah, there's probably some coordination efforts need to go on for a sewer connection, things like that.
What engineers have you engaged at this point?
We have, we've not really engaged any engineers yet for any those type of plans. We have a building cost and we have estimates from contractor to help to kind of plug in those numbers. But I think we're going to work with Bay Design.
Okay.
That's good.
To help us with that engineering work.
And we've had a local sewer contractor that has done a lot of work in the county, look at the plans, review both sets of plans, our plans and the plans, you know, adjacent to us, and see where we might have an easier access, simplify some things there for us, so.
All right. Probably need to be in communication here. You know, about the sewer
Well,
connection.
that was my next question. Have you been in communication with the school system as far as what, how they can use you in the future for an overflow? For what activity we have going on at the new school?
We have had that discussion with Travis Pittman and Ms. Davis about utilizing Dreamfield's parking lot for any type of overflow events.
Is that a problem at all, or
No, sir.
no problem with scheduling games, your games with
Well-
what's been going on at the school?
Well, we don't foresee much overlap right now. I'm not sure, in terms of the sports events there, we have a very limited fall season. So if it's like for football games, we probably won't see very many kind of double booking, so to speak. If there is a special event at the auditorium, the spring season, there might need to be a lot more coordination, but any other time, whether it's the weekend or from, you know, summer through fall, it's probably going to be a minimal impact for us specifically.
How about the transition from the Dreamfields parking lot to the site of the new school? Have you guys talked about what that would look like, as far as maybe if someone was handicapped and needed to park in Dreamfields and?
So I have not had a specific discussion.
I have not seen that in the set of plans that I've looked at. That's a great idea.
Well, I think we asked the boards, we asked the school system at one of the early meetings to get with you guys and to make sure that these things are happening. We don't want to get to the end and then say, oh no, how are they going to get across that ditch to the
Well,
new school?
I assume that from the plans that I saw, I thought that there was going to be an exit for vehicles that comes onto that road in between the two facilities. That is a private road, and so we can only do but so much. But I believe there will be an exit for vehicles that people could use.
That is correct.
To connect,
That's
like
correct.
to get from the Dreamfields parking lot across the street and then to the school.
and it flattens out up near the main road. So the place to do that was to add on to the sidewalk over by the girls' field. If we were to do that, to have that facility just to go where it's level and then enter, I guess, in front of the athletic fields, and then I guess it would tie into the existing, side or foot transportation all the way around to the back, I guess, to the field house and the auditorium. So that's something we should probably
I'm
all
pretty
take a look at.
Yeah, I'm pretty sure there is, and we can reach out to Travis and coordinate with him.
Okay.
Just to double check right now.
Well, thank you.
Any additional? All right, thank you, gentlemen.
Thank you for your time.
Okay, all right, consensus? Consensus. All right, consensus, we have consensus, all right. Okay, over next, Soil and Water District.
Good evening, gentlemen.
How you doing?
Some goodies here for you. We are once again this year just requesting level funding in the amount of $15,000. Every year I come before you, I talk about our record cost share program that we've been having with the Virginia Ag BMP cost share program. Once again, we have exceeded that record. You'll notice the closer we get to the 2025 Clean Up the Chesapeake Bay deadline, the state has put an enormous amount of money into the BMP programs. So historically, I looked back when we started our first year, I believe it was '84, we had $23,000 for Ag BMP cost share funds for the entire Northern Neck. This year, it'll be over $8 million that we'll be receiving and putting back into the local economy. So we've come a long way. Very proud of the efforts that our farmers are making to improve not only their soil health, but to reduce runoff and potential pollutants. We continue to see an uptick in the urban cost share program, the Virginia Conservation Assistance Program, very popular, particularly in Lancaster County with living shoreline projects. Just looking back for fiscal year '23, looks about over $100,000 put back into the local economy and assistance with shoreline homeowners in putting in living shorelines. We continue to assist the county with your Chesapeake Bay Preservation Act compliance by completing the ag assessments. And we are also continuously inspecting acres of cropland under the resource management plan. We're also heavily involved with the school programs. Just recently, Kelly and Lowry have attended the career day at the elementary school. And of course, our household hazardous waste collections continue to be held on rainy days nonetheless in March. But we did get those numbers today. It looks like over 13,000 pounds collected on Saturday, so still a great turnout.
141 vehicles, so even in the rain.
Even in the rain. Lancaster, they're very loyal patrons.
It didn't rain as hard as it did in, September, October last year?
Right. And looking over the historical numbers today, I notified Kelly, we have a very monumental milestone approaching us, and it's probably going to occur on April 20th at the Northumberland Hazardous Waste Collection. The first 912 pounds that we collect, that will put the Northern Neck region, all 4 counties, at 1 million pounds of household hazardous waste that have been collected since our programs began back in 2005. So that is a huge accomplishment for our small rural area, 1 million pounds. So I told Kelly, we have definitely got to involve the local media, the newspaper, get everybody out there. I know it's in Northumberland, but I'd really like to have a representative from each of the localities there. 912 pounds, it'll be early in the event. It won't take long to capture those. But that's monumental for us. I mean, look at what we have kept out of our local rivers and streams, 1 million pounds. It's really hard to wrap our minds around. But we'll be getting some information out to Don and others in the county
about our plans for celebrating that. Oh, yes, and we had elections in 2023. We have 2 new elected directors from Lancaster County, one of them which is with us tonight, Lewis Walker, and then Aaron Rowland from down in the Weems area. So Billy McCarty and Faye Andrashko decided not to seek re-election. We were fortunate to capture 2 gentlemen that really have their hearts into this, and if I could get the rest of the directors to follow suit and show up on time and RSVP like these fellows do, we would really be doing well. Anything you want to say, Brandon, Lewis?
Questions?
I think that's about it.
We're going to celebrate trash, million pounds.
That's right. That's right.
Any questions, gentlemen? Yeah, thank you all very much.
Thank you.
Thank you. All right, consensus? Yeah. Got consensus? Consensus? All right, consensus. All right. Dead Rise Disc Golf.
Good evening, excuse me. Good evening, gentlemen. I'm here on behalf of Davy Nichols of Irvington. I am representing Dead Rise Disc Golf. My name is Marcia Jelinski. I'm a 6th grade teacher at St. Clair Walker Middle School in Middlesex County, and I love disc golf. So let me tell you a little bit about Dead Rise. So it is a passion project from COVID 2020. A group of friends of mine, we usually had a weekly ultimate pickup league. We were looking for something else to do. And like so many other people across the world, not just America, we turned to disc golf. It was socially, distancing, it was outdoors, it was active, it was awesome. But unfortunately, aside from private courses at people's homes, the nearest courses to us are in Newport News, Williamsburg, and Richmond. So we had this dream of creating a public disc golf course that would be accessible to our local community. And we are so fortunate that we were able to make that happen through the support of the local community, through the disc golf community, and everything else. We were able to meet our fundraising goal of $10,000, and $7,000 of that alone went to just the baskets, which are like the holes in golf. Local businesses volunteered and donated their time, supplies, and energy to our cause. We even had a Middlesex Boy Scout do his Eagle Scout project, which was to build 12 benches for our course. In 2022, we've opened, and since then, we have seen people from 17 different states show up, and we have seen over 1,000 different rounds played, and that's just according to one app called UDisc, which is a popular disc scoring app. We have hosted a pop-up tournament which within 48 hours of just saying, hey, we're going to have a tournament, people showed up and came out to be there. We also hosted a legitimate tournament this past summer, which was the Captain's Classic, and we saw people as far away as Virginia Beach and Suffolk show up. We were actually shocked when we showed up to set up registration that people were already there at like 9 o'clock in the morning, pre-playing the course, and were asking us, hey, where can we go to get a bite to eat? We know that this sport is kind of new to the community, so we have a loaner's box, which is unique and appreciated by a lot of the disc golf community. It is a box of discs that have been donated to us that new players can come up and just use. My 6th grade students have told me that they have been to the course. I use this disc, and they're excited that they got to try it out. We have a lot of connections to the local school systems. I know that the high school is being built right across the street from us. Rob Pittman, the soccer coach, golf coach, is interested in starting a disc golf club. We are friends with another co-founder of our organization, Becky Jones, who is a teacher in Northumberland who wants to create a disc golf club. I'm also in Middlesex looking to do the same thing, and I've actually been contacted by our physical education department and Compass Academy about field trips and just introductions to the sport because it is such a lifelong, lasting sport. I've been bragging about why we're here. Why am I in front of you tonight? And the problem is grass. We need help with our grass cutting. When we originally opened, we had a plan. We had a gentleman who was volunteering our services, but within the first year of us opening, he came down with dementia, and he is no longer an option to us. We also had a tractor, and we were pulling the man hours ourselves. Our tractor broke down, and sob story short, a group of volunteers who are doing this from the bottom of our hearts. The grass cutting is a huge endeavor that we didn't know we were going to have to take on. And we are full-time employees of various jobs with families, and it's a little bit much for us. So we're here asking for assistance with specifically the grass cutting and the bush hogging of our course. We have about 30 cuttable acres, and it's a bit much for us to manage and keep at a reasonable and a good thing for us to be promoting for the community. So I know that Davey he is the face of our political side of our organization. He is more of our treasurer. I am here tonight on behalf of him because he unfortunately was unable to make it due to a prior engagement. I know he is, Jason, you've been out to the course and you've seen it. Mr. Bill Lee, he has also met with you. So we are even asking if we could be considered under a node of the Tri-Way Trail, if we could get folded under their funding, or I know you have a lot of parks and recreation general things. If we can get assistance with our grass is the biggest thing that we are looking for tonight. And just putting our face out there to you gentlemen.
Any questions?
I can try my best to answer them.
Okay, thank you.
All right, thank you, gentlemen.
Gentlemen, I'm thinking it's probably something we might want to come back to.
Well, we've talked about it we really haven't talked about it as a board. But we have a Parks and Rec director coming on at some point, and we're going to have Parks and Rec activities. This certainly could be one of those, and if that's the case, then we have an obligation.
What is our current grass cutting like? You said you contracted out like Windmill Point and.
Yeah, but
are we in-housing everything else currently?
Currently, but I believe Carter's Cove, we're in the process of contracting out Carter's Cove.
And Thomas Landing?
Thomas Landing is done in-house with HERE and Social Services.
Currently the land that is still owned by Jimmy Carter, correct? Or is that part of the easement of the Tri-Way Trail?
No, where the course is now is where the old driving range was, and that's on Jimmy Carter's property.
So is there like some indication of like including that into the Tri-Way Trail easement, or?
Well, I think.
Like, what is the plan for that?
I believe that Mr. Carter is going to be proposing some additional homes in the future where the current disc course is, and I don't know if you all are aware of that, but he's told Bill and I that maybe the disc course would go on the other side on county property and be a node off the Tri-Way Trail. And Bill, maybe you can add some more to that.
Yeah, Mr. Carter he's contacted me. The thing about this is almost a little bit ahead of where we are.
Yeah.
It's a fit, but
we're not there yet.
Yeah, we're not there yet. And that's the thing. And then with Jimmy talking about developing the spot where it is now and moving it, we don't know how it's going to look over there. So this request, which is not unreasonable, but it's a little bit ahead of where we are, in our planning. That's the only thing I see,
How often do you cut the 30 acres?
How often? Every other week, yeah. Once a week to every other week. 'Cause it probably takes us 3 to 4 days on personal lawnmowers to get it done. So by the time we finish the front 9, we're already on the back 9 again.
Personally, where I am is to deny this request at the present time.
Well, I want to try to help everyone. I know.
That's right. I agree with
if
that.
If our county citizens are using it, right?
I just think it's a little bit ahead of,
Yeah.
you know, I don't know how we can,
Where are we on getting the recreational director on board?
Just scheduling interviews and, you know, hiring somebody.
So what does that look like?
We've got, we had 11 applications. I got 7 that I'd like to interview.
Have we made any progress on that? Because, I mean, that's been dragging on for a while, those applications. and We don't even know if those people are still available or still interested.
No, well, I know that they are, because I keep getting emails from them, so, but it has been dragging on, but it's not by choice, but by necessity.
Can we move it on so we can basically fold some of these things?
Yeah,
Because these parks are going to be coming online sooner rather than later. And
Yeah, and now that John's on board, he can help with
we probably do
that.
have another year really before these parks are up and running, per se.
At least, probably.
that's why I keep saying it's a little bit ahead of what, I think it needs to be under that umbrella, but I think it's just a little bit ahead of saying, yeah, we can, you know, we can take care of it.
Well, Don, what are your thoughts on it?
If it gets moved over to county property, I think we definitely have, you know,
That's a different story.
have a part in it.
Where is county property? Is it school property?
School property.
Yeah, school property. Yeah, but the county
And
owns it.
some of the land that's not being developed?
Yeah, behind the pond, all the way back to that first hard turn to the right.
Have y'all know anything about this yet, or?
It was put on our radar when we first started, but we were given no time frame. But we were always told we'd have a space to go to. And so I just recently have heard that that's where that space is. So,
Yeah.
like I said, Davey's more of our liaison in this sector of it, but.
Because I don't know, I mean, I don't know what that space looks like either.
Well, here's the other
And there's
thing.
security issues and all kinds of.
That's what I'm
others.
getting ready to say.
Yeah.
I know there's been some questions about that, because I addressed the executive committee. I told them, and first thing, okay, how we gonna secure
We
this?
do have
from
lots
the-
of other county property, though. It doesn't have, could be somewhere else potentially.
It could, I mean,
We own 30 acres just down the street here.
and that's the piece I was thinking of.
So, I mean,
What piece is that?
Right across from VDOT. It's currently being farmed, but
Oh, right,
it's,
okay.
yeah. And, you know, we've got the Good Luck Road site at some point in time too, whatever, you know, that's 156 acres. There may be room there for something like that.
We need to cut that, by the way.
Yeah.
We need to get in there and get that before it gets out of control. No, I meant, what are your thoughts for the immediate? You did a good job of beating around that.
Since it's located on private property, you're going to open up a can of worms by funding this now, in my opinion.
Greg, what do you say?
yeah, I mean, I thought it was already on the easement, but since it's not, I think we need to defer this for a little bit while we figure out some of these park and recs.
Yeah.
And maybe an alternate location that is on county property that could be futurely developed.
So with the Parks and Rec director coming in, if that became part of one of his program, or her programs, would, then we could probably look at it.
Oh, yeah, I would think so at that point, yeah.
Okay.
That's why I keep saying it's a little bit ahead of where we are.
It is,
Yeah.
I know.
Yeah, I think we need to come up with a plan of where we want to put it. You know, here in a couple years, I know we say it's ahead, but you'll also have the property at the high school that would fit that bill and depending on how we're going to use that. So, you know, I think we want to do it. It's just a matter of the timing of it.
Yeah.
So, do we have consensus to strike this
I think for the time being.
for the time being?
Yeah, we're striking it, but not really striking it. We're just pushing it
Deferring
down the
it.
road.
We-
Yeah,
yeah,
defer,
De-
but for
deferring
this
it.
budget.
This budget.
Yeah. All right, Don, you heard
Okay.
what we said, strike.
Mr. Palin, I want to challenge you to a round of,
Yeah, but teach me first. Thank you, Don. Okay, good. All right. All right.
Yeah, right across from VDOT.
All right, free health clinic, Ms. Nelson.
John, it's the piece I spoke to you about a couple weeks ago.
Yeah, yeah.
Pecos Road. and-
Yeah.
Peckersville Road, yeah.
I'm getting trust issues here lately. People promise you stuff and then they don't come through. Or don't come through like they tell you so.
You by yourself tonight?
No, it was a little late for a lot of us.
Lost. Not basically involved in
I'm just getting going, so you're in luck.
And you're married?
I'm sorry, Miss
you're
Nipple.
good.
I'm sorry.
I'm
You
not
go,
sure
you
if-
go ahead, go ahead. This had nothing to do with you.
Mr. Fallon's just excited about playing disc golf.
He's been challenged.
We could turn it into a fundraiser.
Thank you, sir.
Well, Mr. Chairman and Board of Lancaster Supervisors, thank you for this opportunity. You know, I'm going to start off with, 30 years ago, the state and the county paid for this care, and they, in the 90s, moved it into Medicaid, and there were still gaps, and they expanded the Medicaid again in 2019, and there's still gaps. So, I thought after 30 years, we would be moving forward in a solution, but we're going to be here for a long time. And it is a community effort, and I think the way it's working is very important for all the layers and the spokes of fundraising from the county to the state to individuals, foundations, churches, community organizations. We go for every spoke of the wheel in fundraising and continue to move forward. We had a state association meeting last 2 weeks ago, and people thought when Medicaid passed, and we expanded it to the 138, that there would be less need. And unfortunately, the Medicaid doesn't pay as much, so finding providers can be very challenging as well. So just to give you an idea, today is, I know it's the 26th. Tuesday. That is not a good sign. Maybe it is late for me. But in just the last 2 days, we have had 15 new patients, just giving you an idea of what's coming through. We grew 20% this year and in services, and so the need continues to grow. In 2019, the state came and asked if we would step up and take Medicaid, because the population we were serving was many of those persons who would need the care, and providers to be able to get is quite complicated. So the clinic, a number of free health clinics stepped up, and we were one of the larger clinics, and our board voted to agree. To give you an idea, in our dental, which we get probably about 40% on each visit. So it gives you an idea that in some of the practices, that in order to be able to take that, you need a payer mix that will keep you floating. So these community efforts bring a unique approach to make it work and to give the care to the people who fall through the gaps. The other thing is they thought free clinics might not be needed, right? And there was talk in the state at that. And just to give you an idea, there were 14 new free health clinics in Virginia added this past year. So the need continues to grow, and these numbers just kind of explain that, it's going to be a creative solution. We continue to move as we go through. Our healthcare is very complicated, and the challenge for people without a lot of resources have it most complicated. And I have to say, our care is probably the best care you can get in this area. I would challenge anybody at this point. I'm very proud of the medical, the dental, and the pharmacy.
that we're able to provide, and the service. You know, our patients are really complicated. They're not quick visits. They're anywhere from 30 to 40 minutes, but the results and how they are moving forward with their health is very positive. I'm really excited that we've added a new program. We did get funded. I talked to Don about this, and I'm very excited about this. It's a peer recovery specialist. Many of you all might have heard about it before, but it's dealing with substance abuse, trauma, and mental health. And so we'll be adding therapy in our building, plus we'll have 2 peer recovery specialists. One started on Monday, and we have another one who will be starting within by the end of April. That is, as you know, a very needed piece. You know, often, and our medical director, you know, we haven't had a lot of the drug people coming into our clinic, right? And the reason is it's on the streets. You know, you can't get opiates like you used to, and the fentanyl is a very complicated piece. But, you know, there is the combination out in the public is, you know, the addictions and the need is huge. And it crosses all sector of our community. On Thursday of last week, the peer recovery came through an initiative that we were selected through the state association to be to replicate a program that is in Roanoke. It's called HOPE, and it's from the HOPE initiative started out of the actually up in Massachusetts. But, and they copied it and created it their own and brought it into the Roanoke from Massachusetts, and it's been very successful. And so we were the first to be selected to be able to replicate this in the state, so we're very excited about it. And while we were doing a Zoom talk, just to give you an idea of as we were talking with the group from Roanoke, from the HOPE Initiative, we hung up the phone, and I get a call back within 10 minutes, and this woman goes, Jeannie, I said, and this is a head CEO, she said, I just had a peer recovery specialist walk in my door and said, hey, can someone tell me where the Northern Neck is in Virginia, because we're getting calls from the Northern Neck. And what happened is people were reaching out in this area looking to find a place where they could get support and help. And so we're really excited about moving this forward. You know, we've got another big couple years coming, and, you know, we'll be looking at on how the clinic will continue to evolve. But I appreciate your part that you all have played. You've been very supportive, and with your support, we've been able to push out and reach out to other entities and to more people, and keeping it a healthier place to live in this community. So thank you all. Are there any questions?
I got a question, because we just heard the lady from CSB, and part of their program too is peer recovery.
Exactly.
Have you all been in contact with CSB?
And the CSB, actually, CSB has a group that comes to our clinic, so we'll be interfacing. It was day one, and we'll be going up to reenact the HOPE initiative with our peer recovery specialists. But all those parts will be connecting with all the layers. The CSB, we've contacted the police, we've touched base with the Commonwealth's attorney, and we'll be opening up too. They are very supportive too. We interface with the CSB. They, at this point, I think we have plenty of room for more peer recovery specialists, and they have, I think they would be hiring more if they had some monies. So
the HOPE initiative, is that a program that starts with early intervention and then goes through a process of someone that might be fully.
And it actually, you know, the difference is with this is they stay with the contact for a year. And they help coach them, and they help them get into resources. It's not necessarily always in Virginia. It could be in another state where they're able to get them into. And then they're also helping them get through some of the challenges. I mean, part of the, as you're leaving a group of people that you knew, you're making a new group, and that is very important in the recovery, is to move forward with a new set of tools to be able to continue to stay in recovery. And what this will be helping them get to choose a place and help coach them. They also help, you know, in the peer recovery specialists, this group will be helping them navigate birth certificates because they need a job, and in order to have a job, they will help them work through the resources of getting they're finding a birth certificate, so then they can move forward with a driver's license and move forward with getting a job. So there's a lot of coaching and support that they give, and it's a contact for keeping contact with a year for them. And that is what they have found to be a very strong tool. Their statistics are 83. They presented to our board and actually to Don. They're having like 83% success. And part of it is because they keep them, and, you know, recovery isn't a straight linear line. And, you know, there's a lot of initiatives happening around here. The goal is to expand, to bring all of those together and to be reaching the need. So it's not to take away anything that is already here, it's to expand it and to reach out to more.
Any additional questions, comments? Ms. Nelson, I know you requested an additional change in the budget amount this year. How would it affect you if we just level funded you?
You know, I'm very thankful for level funding. You all have some big initiatives on your plate. I keep up with what's going on, too, with the county, and I'd be very appreciative.
All right, thank you very much.
Thank you.
Okay, all right. Okay. All right, gentlemen, consensus for level funding?
Yeah.
All right, all right. Okay, level funding. Okay. All right. Community Library, Ms. Cooper.
Hello, everyone.
Hello.
Thank you for this opportunity to speak to you about the Lancaster Community Library. I'll be focusing on the programmatic elements, and Rita Tyson, our board president, will follow up with more of the financials of the library. So I think you just received the report I sent to Dawn late this afternoon, so thank you very much for making those copies. We're really excited that our mobile library has arrived. It's been a multi-year project, and COVID didn't help it at all. It certainly slowed down the process. But it did arrive on March 14th, and you can see it in the photo. We believe starting April 1st, the exterior will be wrapped. That was one requirement that the board made, that certainly we don't have facilities here that could build the unit, but we could fund local business to do the exterior wrap. We're so grateful for our community who provided the support for this vehicle. It's a pricey, very, very nice one. Our Friends of the Library book sales were designated for many, many years toward this project, so we're really happy to see this fruition. And the area foundations also chipped in, as well as a bequest. We do believe that it should be ready for, I think our first big event with it will be the Bon Secours RGH Play Day in the park on April 27th. So if you're going to that, Joanna Marchetti's pretty excited that we'll be there. We do plan to have a community-wide celebration in June. We hope that will give some time for our funders like the DuPont Fund to make arrangements so perhaps they could come. And our library board meeting is tomorrow, so we should have that date by tomorrow, and we'll certainly invite you all to attend. I didn't mention on the report, but I need to, is that combined with the mobile library, we are going to initiate the Dolly Parton Imagination Library. I think I may have mentioned this before to you, I'm not sure. And that is a program where the Imagination Library pays for books, and local sponsors pay for a much reduced postage cost. And what it does is provide books monthly to children from birth to age 5. So we think that'll be a great thing to implement with the mobile library as it goes around the community, goes to festivals, et cetera. We'll be able to sign families up for that program. Few statistics for our fiscal year through February 29th. We've circulated 35,081 physical books, audios, and videos, and 14,121 ebooks, e-audios, and streaming video. The electronic side of library services is definitely increasing every month. Every day, new people come in to sign up for our Libby or Hoopla apps so they can get their ebooks. We've had 874 programs this year so far, and that number of attendance is pretty spectacular, 37,614. Part of that is due to recording all of our children's programs, our baby garden and story times. They in turn end up on our YouTube channel and on Facebook, and so many years ago, you may have been familiar with Barney, where kids would watch Barney over and over and over again. Well, around here, sometimes they watch Miss Tanya over and over and over again. It's a good thing. Our meeting room and study rooms are highly used. So far, we've had 944 uses of the rooms by community groups, as well as state-level groups. We have gotten known as the best meeting room space in the region. So state organizations, when they come in for their regional meetings, are having them at our place. We've had 3,142 computer sessions, and that is people using library computers, logging on, et cetera. So still really important for us to provide computers, and in some ways, maybe a little more important with people using their phones as their computer devices to a large degree. People are walking in not even owning a computer, but there are some operations that really you do need to sit at a desktop. So our staff are busy often helping people with getting on to, it could be taxes, it could be unemployment, it could be any kind of legal communications, what have you. It all happens at the library. And then lastly, the other thing that's skyrocketing in our stats are our Wi-Fi sessions, and we're at 50,489 since July 1st. I was pretty surprised to see that myself. Next week is spring break. Well, it starts, I think, on Friday, actually, and so we are really excited for the second year to offer several programs for our families coming up. We're starting out with bingo on Friday. Y'all come, it's fun. And follows up the following week with story time. We have a DIY book bag project with Miss Kate in the Teen Center. Mario Kart tournament. I still am not entirely sure what that is, but when we had our Comic-Con last fall, it was hugely successful. It was fully booked, and so we decided we needed to run that again for our young people. And it's a competitive situation. It's held in our upstairs meeting room. You're certainly welcome to come and see what it's all about. We have a creative writing group also next week. And then back by popular demand on Friday is popcorn, punch, and paint. It is quite a sight and very popular with the families. All right, do you have any questions about the programmatic elements at the moment? Okay.
Questions, gentlemen?
Thank you.
Thanks, Alice. I appreciate the opportunity to be here, and we are very grateful for the support that the County Board of Supervisors provides to us every year. And let me get something out of the way before I start, and that is we had a Finance Committee and a Executive Committee meeting yesterday, and we agreed that level funding was going to be just fine. So thank you. We understand, as Jean said, we understand the extraordinary demands that are being put on the county with the schools in particular. Alice gave you an overview of some of the, of a lot of the things that the library does. She mentioned specifically 2 new initiatives, the mobile library and the Dolly Parton Imagination Library. I know that the board likes to see community support. They don't want to be the ones holding the bag all the time, the money bag, I mean. So in the spirit of the Lord helps those who help themselves, I just wanted to mention that with these 2 new major initiatives that Alice mentioned, no taxpayer dollars were harmed in the production of these initiatives. They are 100% fully funded by the community. The Friends of the Library received special mention. Their efforts over the years with their triennial and biennial book sales in the old building have provided, for lack of a better term, seed money for this library. The impetus, the encouragement, and an amount that is approximately 25% of the cost of this vehicle came from the efforts of the Friends of the Library. The Friends of the Library also gives a connection to the Dolly Parton Imagination Library because we received a $50,000 bequest in the name of Dee Witchard, who is the namesake for Dee's Attic. She hauled books up and down the stairs for years to help manage those book sales. And her family has graciously given $50,000, which we have put into what we hope will be a perpetual fund that will provide the amounts for the library's obligation to pay for books and shipping for Dolly Parton Imagination Library. So obviously these operations will require additional administrative support through the years, but right now these are totally 100% from the hearts of our community, who we're very proud to provide them with a library that they love and support. And if there are any questions about any of that, please let me know.
Any comments, questions?
No, thank you.
Thank you.
Thank you very much.
Thank you.
All right. Okay, gentlemen, consensus for level funding?
Level funding.
Okay, level funding consensus, all right. Thank you. Okay. All right. Let's wait till Bill get back.
Okay,
Right.
that's it?
Well, I want to go back to one more.
Okay.
Like the river rim.
Oh, River Rim.
Uh-huh. That's on page 4.
I'm gonna make this easier on y'all Thursday night. Instead of giving you like 2 agendas, I'm gonna put the page numbers on here. So
It's 37.
37. Okay.
I didn't put them on here because that whole booklet is not online with
Right.
this. So that's
I saw this, but then I forgot I had it. Yeah. And I know you're always prepared, so I said,
it may be handwritten numbers, but you'll have them on Thursday night on the
Page 37,
on the
River
agenda.
Realm.
What did you say is the fifth year of the River Realm? Is it the fifth year we've been in it, or since it started?
No,
Is it
we've been in
longer?
River Realm for a long, I
How long
mean,
did it go back?
that I don't know.
Can't remember
Yeah, I'd have
now.
to,
I thought it was 2015 or 2016.
yeah, it's been a while. Yeah.
But the funding's been pretty stable over that time.
It has, yeah. I think, I remember one increase since I've been county administrator. I think it went from 20 to 25.
Yeah.
But that's been probably
Yeah.
7, 8 years ago.
All right, we'll wait for the bill. We going back to River Realm. Because I like to go ahead and take care of this tonight. What's your thoughts on this?
I don't have any problem. I think it's been really successful, and this is, I mean, part of what we're talking about, promoting and stuff. This is our main marketing brand, so
This is right
I
up
think
your
it's right
alley,
up.
right? It's part of the future of the county and what we want to do.
What are you saying, Bill? Okay.
I said, no, I mean, that's part of what we want to do here as a board, is promote our county and not just with tourism, but certainly business. I'm not sure I understand 100% on how it works with the counties, though. That's the one foggy spot for me, is that I know Middlesex is part of it, but the county doesn't fund it. They've broken off and gone into a private
Yeah,
sector.
no, they're Economic Development Authority, which is.
They've taken it over.
Yeah, they've taken
Okay.
it over. So, and they funded the 25,000 equal to what Lancaster funds. But for this additional money that Susan referenced tonight, she's only asking Lancaster for the additional 5, Kilmarnock for the additional 5, and then they're going to go out to their paid advertisers for the other 4,000. They're not asking Middlesex for it.
Because they already have
Because
it.
Middlesex already has it, so,
So
but that's,
if Middlesex already has it, don't we already have it?
no, not this, this widget thing that she was talking about, and
But I thought the River Realm was the River Realm. So I guess my question is how do they have it and we don't if it's one organization?
no, we're all a part of the River Realm. Susan's talking about the, and what was the correct name of it, the app?
Widget.
It's called Visit Widget.
Visit Widget, yeah.
It's probably on their individual Middlesex website.
Yeah.
The Blue Ways uses it.
So we can, even though it's the River Realm, we're still independent from each county and what we offer.
Yes, and in prior years, Irvington and Whitestone had not given any money to them. So they've started contributing now.
Start stressing it.
Yeah, and I think Urbana was on board right from the beginning.
Would
North Thunderland refused to join.
Yeah, that's right, yeah.
Would each
so-
county have to license this app? Is that?
I don't know. John, do you know anything about that?
No, from what my takeaway is that the Middlesex Blue Ways had gotten the app on their own accord, and they're already using it, so River Realm could just co-opt what they have, and that this would be setting up that app for Lancaster County specifically, for us to, for this county to use, because Middlesex already has it.
Okay, so this app will be a different app from what Middlesex got there.
It'd be the exact same app. It would be it's the same app, but they're already using it for their Blue Ways, for Middlesex Blue Ways. And so this would just be, they can co-opt the app that Blue Ways is using for River Realm purposes. This is setting up the app in this county. That was my takeaway, but.
So if I download the Middlesex app on my phone,
Well, it would be the
would be
Virginia
linked to
Realm
Middlesex.
app.
Not right now.
Not right now.
But after this is done, it would.
The 5,000 would pay for setting up our information.
Yeah, and it was a
But
full.
it's not a licensing fee or anything?
No.
Okay.
It was a.
Okay, and then there is each year would have to be a cost to
Yeah,
the
she
upkeep.
says $11,000 a year.
$11,000 a year.
Yeah.
Yeah.
Well, no, I'm okay with all of it. I think it's a great thing. I just still don't, I can't grab hold of the whole concept of how the counties work.
So if we granted this 5,000 for this, increase for this budget, then that put their budget at 30,000. So that would be continuing from year to year, 30,000.
No, because they make their request annually.
But
So
they're probably coming back with 30,000 or additional.
that would be my guess.
Don't
but,
let it go down.
Well, I mean,
No.
if they continue to use the app, then, I guess we would continue to support it if it was working.
Yeah.
All right, so what's your favor?
So really, what we're doing, increasing the budget to 30,000.
Yeah.
And it's gonna be 30,000 annually,
Yeah.
unless, they come back and say, well,
Yeah.
it'll be 35,
Which
Yeah.
they probably will.
But it's not gonna go back to 25.
No.
I don't have no problem with it. The only thing I'm not quite getting in my head, and I'm not, this tech person on this stuff, this app is already there now, but the Lancaster part of it is not there, right?
Right.
So
That's
I
right.
liken this to kind of like the conference app. When you go to a conference, you can download the app for that particular conference. You can go through all the sessions. You can pick the ones you want, and it makes a schedule for you and gives it to you, and you just follow it. So something like this, you would go on to the app, and you'd see all these activities. So I was like, okay, I'm going to go to the oyster tasting at 10 o'clock. I'm going to go have lunch at the Tides at 12. Then I'm going to go to afternoon disc golf, and then I'm going to go to have, and then it would create an itinerary for you.
Yeah, how come I can't do that now if I'm in Middlesex?
Well, you could, but it would be only for it would only be promoting you Middlesex stuff.
I don't
So-
think it's got any Lancaster content on it.
it doesn't.
No, it doesn't.
And that's what we're paying for, is to put that.
That's right.
Lancaster-specific content on there.
That's right.
Correct.
I think, that's the way I understand it.
That's right.
Correct.
If I may, I had conversations with Lisa Hull at Northern Neck Tourism years ago about the need for itinerary tools. And when we created the Virginia Water Trails website, which shows all the water trails for the region, including Lancaster County and its public access points, the idea is when people came to do water sports and paddle on them, they could have something that would populate and say, oh, by the way, while you're here, shop here, go here for lunch, go here for dinner. And that has a real value to it be additive to any visitor or even any resident.
So that's what this app's supposed to do.
Especially if you're kind of
Would do
promoting.
that. The push notification thing really caught my attention because
Yeah.
it's locational, and if you're there, they can go, oh, by the way, here you go.
That's why when you drive by Walgreens, you get a coupon for on notification on your.
That's exactly right.
Do you see us having?
My phone doesn't do that.
You must not have the Walgreens app.
No, I think this is and it's really, an app is a bit of a misnomer. It's just a widget. I mean, it's kind of like, it's like on your screen, like you have a widget for the weather on your screen. It's not an actual app. It's just a widget. It shows you the content right there on the main screen. You don't have to click on the app to go see the content. It can show you a certain level of the content right there on your phone screen. So it's
So yeah,
in
when
your
you go to
face
your back
constantly.
screen, you have like all those different things on your.
Yeah.
I didn't know you spoke Greek.
Well, after more explanation, I don't have a problem with it.
So you're certainly in favor of this?
I think it has a real value for the.
I feel like it does too.
That's our economic development.
That's right.
Yeah. So we got a consensus on this?
Yes.
We got a consensus, all right. So we can check that one off. All right. Thank you, sir.
All right.
He just earned his pay.
Yep. And Susan owes you a lunch.
I didn't know I was in sales. Other duties as a side.
Other duties as a side, yeah.
So, John, on the website or somewhere, because people gotta know about the app,
Yeah.
So, how's that information get to me?
Th-
I know about it now, but how's that gonna get to the regular population?
This is a good question, and if I may, what I'd like to see from Susan and the River Realm folks is to involve me more in the development of the webpage that's specifically for the county and those public access points that the ARPA money is being used for, and for the development of this app, so I can make sure that it's doing what we want it to do. You know?
Don, tell her
Some
that.
kind of way, you know,
Well, that's just
people
it.
gotta
Our
know about
funding,
it.
our
Tell her that
funding is tied.
$5,000 addition
Yesterday,
of
just
it
included
in front of
marketing,
Father
little
John.
buttons and stuff like that they give out, and that would be my guess.
You know,
Well,
They'd
it would
go
be
out
on the
on their
River
social
Realm
media, of
website, I'm
course.
sure.
Yeah.
And then it would, be linked to
But
our website.
Yeah, well, do we do an advertising campaign to let people know where to find the widget and?
This would be a very good question. I mean, I would certainly like
Yeah.
to see something that really pushes it out there. I mean,
Yeah.
advertising an app is not exactly easy.
No.
I mean, is it gonna be popping up on Google Play or Apple Store? Where is it gonna show up at? I mean, what are you gonna have to type in to search for it, to find it?
It
You
seemed
know.
like to me they're gonna house it on their main webpage, and then
Now, they do a lot of advertising in
Well-
magazines and stuff like that. They're pushing that out. Could that be included in some of that?
they do
Yeah.
a lot of social media
Yeah.
push, like
Yeah.
marketing.
Yeah.
Without a doubt. When I was at Wetlands Watch, they have an app, and they concerted effort to push that app out.
And my guessing, once it's developed, all their public appearances, or when you go places, they would have swag that would have their, like, hashtag on it.
A QR code that somebody can snap
Yeah.
and take you
Yeah.
right to the app.
So what we are saying is, okay, we approve this $5,000 increase, but there's a caveat. We gotta have John on the design.
Yeah, that's what I said. Tie that, earmark that.
Yeah.
Absolutely.
Plus, I think we need to evaluate it after a year or so and see if it's doing what we think it is.
Yeah, and I think John, being right there will know, okay, this thing is beneficial to the county, but, it's not or
Let's
whatever.
invite this widget to one of our board meetings and we can, so I
At this
will,
point, John is our liaison to the river realm.
Other duties as assigned.
before you hit the gavel, I will be at the 7 o'clock meeting on Thursday, but I will not be at the 5 o'clock meeting.
You can't take it anymore.
I just can't take it. In fact, I might not even come to the 7. But one thing I want this board to think about is when Sheriff McCraney is going to present his budget, and it's not, it wouldn't be out of the realm if we asked the towns to help to pay for one of our dispatchers. Other towns do it. Other counties coordinate with the towns. I know that he wants to fund another, and it certainly isn't out of the question. And if that takes place, we have 3 towns, we certainly could look at which town has the most traffic, and I think we know which one that's gonna be.
We charge them by call.
Just food for thought.
So to fund one of the dispatchers.
Yeah, to fund one of the dispatchers, and I would think
For the
with
towns.
benefits and everything, the
Probably
number
looking-
could be 55 or 60,000.
Close, yeah, somewhere around 50.
Or multiple towns could contribute to it.
Well, that's what I'm, yeah, I mean, to take the 3, and I don't
Yeah,
think we can
split it
divide
up.
that by 3. I think
No.
No.
that wouldn't be very fair, but
Well, I tell you, there's a lot of time spent by a deputy in Irvington now because I see them there just about every day now.
Yeah.
Because I'm worried to death they're gonna get me going or coming one day.
you know what, it's working, because I don't hear, unless they just won't call me anymore.
And one was there, one was there in an unmarked car today.
No.
I move for adjournment.
All right, we're going to recess this meeting until March the 28th at 5.